Thank you all for joining us. That's great. For this conversation on comprehensive sexual health education, it's really great to see you all here this evening. I have a little bit of housekeeping, which is that the bathrooms are over here. We have some tea and cold water over here if you'd like to stay hydrated and cool. And please utilize the shade that we're providing so that you don't get too hot. We gather for this meeting acknowledging the Ute Indian tribe of the Uintah and Ouray Reservation, on whose ancient and sacred land we live, work, and play. We gather for this meeting acknowledging the respect to elders of the past, present, and future, and honor the spiritual connection to this land. I would also like to thank supporters of this work in our community, including the Camp Foundation, the Colorado Trust, the Buell Foundation, the Trailhead Institute, Delta Pride, as well as many individuals who have given their time and support. Thank you. I would like to welcome Dave Knutson as our moderator today. Dave brings leadership and human resource experience from the private sector, local government, and nonprofits. He is the founder of Orion Rising, LLC, has served on the boards of the Outdoor Industries Conservation Alliance and the Grand Mesa Nordic Council. He was a founder of North Fork Senior Connections and currently serves on the Paonia Town Council. Thanks for being here, Dave.
Okay. Thanks, Alicia. Wow, I haven't gotten applause since the beginning of the pandemic. Thank you. I want to do a quick overview of what we're planning for today. And I'd like to reinforce the title of the group that's sponsoring this. This is the Learning Council. So I want to make sure people understand this is the Learning Council, not the Debating Council. Okay, debates are best done in front of the decision makers, like when I'm serving on the town council. We should be having debates there. But in this case, we're asking people to really come with an open mind and look for what can I learn, what's new information, those kind of things. So let me go through, if I may, what we're planning for today. We'll start out with introductions of our panelists, and those will be short, like 60 seconds apiece. Did you hear me? So what I'll do as the timekeeper and moderator is if you're getting close to your time frame, I'm going to be going like this, asking you to kind of wrap it up. Okay, if you can go with that. So after we've done the introductions, we're going to go right into the presentations. And Deja and Danielle will be doing about 15 minutes that's an overview that kind of gives us all the same framework to work off of. And then we're going to have Chris, Javier, Adrian, Heidi, Alicia, and Josh each speak for about 5 minutes. After that, we're going to do something a little unusual because we want to hear from you and we want you to be able to discuss with each other. So we're going to do breakouts of everyone that's here, and you're going to get about 15 minutes in a breakout. What you'll be doing is answering 2 questions. One of them is, what did I learn from what I've heard so far? And the second thing is, what is the burning question that this group might still have? So those are the 2 things we want you to do. We're going to ask for a spokesperson from the group to come up and do a little review of what each group did. And then we're going to close with a question and answer session. So is that clear to everyone? Are you on board with us? Okay, great. So we'll start with introductions, and if I could start with Deja and Danielle. Put you on the spot.
Hi, everyone. My name is Danielle Tuft. I use she and her pronouns, and I'm from the Colorado Department of Public Health and Environment in Denver. I am the Sexual Violence Prevention Program Manager there, so I oversee our work with comprehensive sex ed as well as sexual violence prevention. And really, I think we're just excited to serve as a resource to you all and kind of hear from you all what your interests are around comp sex ed and how we can kind of partner and explore with you all moving into the future.
Hi everyone, my name is Deja Moore. My pronouns are she, her, hers, and I also work at CDPHE, the Colorado Department of Public Health and Environment. I'm the Comprehensive Human Sexuality Education Program Coordinator for this grant program, and so we're really here just to really demystify comprehensive sex ed and really just serve as an opportunity really to provide resources around sex ed and why it's so important within your community. So thank you for allowing us to be here.
My name is Christopher. I go by he, him, please. I am here to share experiences, but also to answer any questions of the community. I have lived in Delta for a few years, and Montrose before that, and pretty much in Denver before that. So I am here to be kind and to listen to everybody. Yeah.
Hello, I'm Javier Sainz. I'm the president of Delta Pride. That is a LGBTQ organization for the community of Delta. We also represent Montrose, Ouray, and different places like that, so we're not just exclusive to Delta. We do represent a lot of our youth. We also do a Grand Valley Shining Star pageant, which fortunately Chris is one of our national title holders. We do have 4 youth from the Grand Valley that represent all of you. And they do have to do volunteer work. They do have to be outstanding members of the community. We do hold our standards high for people that work with us. And I'm here to educate. I am a trans man, and I will be open. My pronouns are he, him. My shirt, I just wanted to let you know, it's humankind, and that's what we're here for. We are all part of that race, and we are all a part of that same kind of love that we all need.
Hi, everyone. I just want to start by saying you all live in such a beautiful community and such a beautiful part of Colorado. I've never been to Paonia or Delta, so I'm just really grateful to be here. My name's Adrienne Wall, and I use she, her pronouns. I'm a senior program manager at Trailhead Institute, where I manage the youth sexual health program there. I currently live in Denver, and I thought we were supposed to share our hometown, so I'm going to go ahead and do it anyways. I'm actually from a small town in Washington State called Yelm. And I'm just, like I said, really excited and grateful to be here today, especially amongst so many experts and advocates of sex ed. And I've been in the field of youth sexual health for about 6 years now, and I'm just really passionate about ensuring that all young people have access to sex ed that's comprehensive, inclusive, affirming, and accurate.
So I'm Heidi Marlin, and I'm a physician in the area, and I've been in the area since 2008. I'm originally actually from Tigard, Oregon, which is outside Portland. I'm a 4th generation Oregonian, and but love living here. It's beautiful. I love this part of the state. It reminds me more of Oregon than Denver does. And I'm here just to help provide any medical accuracy questions. And if I don't have the answer, you know, that's sometimes the thing about medical accuracy is that we're always learning more things. And so I'm here to provide that part for the panel.
Hello, my name's Alicia Michelson. I am the director of the Learning Council. I moved to Delta County in 2002 to participate in Delta County Schools Vision Home and Community Program. I have 3 sons, and I'm a sexual health educator here in the Valley. I serve on the oversight entity for the House Bill 191032, which you'll be hearing more about. I also run the TLC Kitchen and curate community classes, workshops, and events with a focus on arts, practical skills, agriculture, social justice, community building, and health and vitality.
My name is Josh Langell Hoppy. I am what we call an ordained elder in the United Methodist Church. I'm a pastor. I have been a pastor for 17 years in the United Methodist Church, and I have been in the North Fork Valley for just over 2. I currently serve Hotchkiss and Paonia United Methodist Churches.
Could we have a round of applause for these panelists? Not one of them went over a minute. It's really great. So I'd like to read some ground rules for how we're trying to conduct this. First of all, we'd like respectful questioning and communication. We'd like to encourage positive assumptions. Ask yourself, how can I be constructive to this dialogue? Look for new insights and new perspectives. Agree to disagree without being disagreeable. Alicia summed it up by saying, don't yuck my yum. Exercise self-restraint and seek common ground. As I said before, maybe I'm taking longer than a minute. As I said before, this is the learning council, not the debating council. So we're really trying to come here with open minds to learn. So we're going to start the presentations now. And as we go further, we'll be going into breakout groups. Okay? So we'll start with Deja and Danielle.
Awesome. Well, again, just thank you for inviting us to join. We made it just in time today, and it was such an awesome drive to come down. But we wanted to just take a few minutes to talk about what Comprehensive Human Sexuality Education, or CHSE, as we will use moving forward, is as it's defined by state law, the research benefits to providing this education, as well as additional information about our grant program and some of the supports we can offer.
And so now I just want to provide more context to Comprehensive Human Sexuality Education. I'll refer to it as CHEES, as we kind of do within our internal department. But really, I just want you all to know that it's a research-based strategy that really supports our young folks as they really navigate sexual development, also in terms of how they communicate and make decisions around their sexual health. It really equips young folks with age-appropriate information. And I think that's important for folks to really understand that it is age-appropriate, and really we're helping build a lot of their skills around a broad range of topics, which include anatomy, puberty, adolescent development, healthy relationships, and consent, because I think consent is really important, right, when we are communicating our needs. Also around sexual orientation and gender identity, reproduction, and then also STIs and safety. And so this education is really crucial in improving adolescent health, and that's the big takeaway from our talk today. It's really been shown to delay the onset of sexual activity, reduce the frequency of sexual activity and the number of sexual partners, reduce unintended pregnancies and STIs, and really increase condom usage and contraception use. And there's even more from what the research shows. And so it's really indicative of inclusiveness, which is really important, right? Because we have to get out and make sure that populations that are marginalized, they have the opportunity to get that information. It reduces risks of sexual assault in college and lowering reports of bullying in schools, because as we know, bullying can be a huge factor, you know, with students being able to feel accepted and comfortable within school settings. And really decreasing bullying amongst our LGBTQ plus youth, decreasing risk of depressive symptoms and suicide ideation. So beyond risk, I want you all to know it's really important to strengthen our protective factors. And what that means is our protective factors really influence our young people's health, to connectedness to their schools and to their peers, and also adults and parents. And it can really be valuable opportunity, you know, for schools and the community to join together to do this type of work. And so there was, CDPHE joined with the Trailhead Institute in 2019 to do the Healthy Kids Colorado survey. And what they did with that survey is they surveyed students within this region, within Delta County. And what they really found is that there's youth within Delta County that are more likely to have sex at a younger age in comparison to the rest of the state. And that's really important for you all to know and take away from today's session. And there's about a quarter of students right here in this region that have sex at, you know, age of 15 or younger. And by the time a lot of this youth reach 12th grade, they're more than half of that already had sex. So what we know, our youth are having sex, and we can't ignore that. You know, whether, you know, we agree with it or not, that's what is happening. And it's important that we acknowledge that. And it's important that we try to mitigate that, right, by providing access to sexual health information and services, and really enhancing a lot of those positive relationships with you all as adults and as parents, and really trying to strengthen those decision-making skills with the youth. Additionally, what we know is more students report being teased because of their gender identity or sexual orientation than students within the statewide region. And there's a lot of wide disparities within Delta County in this region, specifically for folks that identify as bisexual or even are unsure of their sexual identity. And there's higher rates of negative mental health and suicidal thoughts because they don't have the resources and support system that they need within this community. And it's important to note that these inequities really within suicide ideation because of their sexual orientation and gender identity is why we call for the need for comprehensive human sexuality education. We know that heterosexual and cisgender norms really dominate our culture and our systems. And cisgender is for folks that don't know, it's just basically when your personal identity of your gender marker aligns with how you identify, both in your expression and also how you were assigned sex at birth. And so this social context really results in LGBTQ plus folks experiencing discrimination, stigma, bias, even rejection from our family, our friends and community, and it really limits the type of care that we deserve and the type of care that we do need. And so I'm going to transition it to my supervisor, Danielle, to talk more about the legislation and why it's so important that we have comprehensive sex ed.
Thanks, Deja. So Deja went through a lot of sort of what we know about what works with comp sex ed and why it's important and how it benefits our young people in our community as well as statewide. And so kind of knowing that, I want to just take an opportunity to talk about the actual state law in Colorado. So I want to say that comprehensive human sexuality education is not mandated in Colorado. However, if a school or district chooses to provide this education, then it must be comprehensive, meaning it follows the guidelines outlined in the law. There's often some confusion around that, so I just wanted to be clear. And House Bill 19-1032, which Alicia referred to earlier, was passed in 2019, and it updated the existing law in Colorado to clarify content requirements for public schools and districts that offer comprehensive sex ed. Many of these requirements already existed from previous law passed in 2013 and were not actually new to the 2019 law. In addition to these updates, the 2019 legislation funded our grant program for the first time ever to support schools and districts to implement comprehensive sex education in a way that's medically accurate, age-appropriate, culturally sensitive, and inclusive of a positive youth development approach. And you've already heard that from some of us at the table too. So what does that actually mean for our young people? It means that we're providing and promoting instruction that's rooted in and consistent with scientific evidence, which is ever-changing, as we also have heard. It corresponds content to the age level and development of young people. It honors and integrates youth histories, experiences, and needs, especially those who've traditionally been excluded from sex education in America and Colorado. It's driven by youth voice and leadership. In alignment, when we talk about a positive youth development approach, we focus on helping youth acquire the knowledge and skills they need to become healthy and productive adults. It helps ensure that programs, our practices, our policies are holding opportunities for youth to incorporate the development and practice of skills and build authentic relationships, which we already know are critical protective factors. So to expand a little bit on those content requirements that I mentioned previously, in alignment with state law, comprehensive human sexuality education must include 3 things. So first is education on abstinence and all forms of approved contraception, condoms, and other barrier methods, sexually transmitted infections, healthy relationships and consent, and safe haven laws. 2, information and resources that are relevant to communities of color, immigrants, LGBTQ plus communities, people with disabilities, people who've experienced sexual violence, and others who have been left out of sexual health education programs and policies. And number 3 is that instruction that does not use language or tools that are shame-based or stigmatizing and that don't employ stereotypes or exclude the health needs of LGBTQ plus and intersex individuals. When we include content like this and inclusive information, comprehensive sex ed encourages honest discussion and instruction that prepares all of our students to be able to make informed decisions about their own sexual health within the context of their own personal experiences. We know in Colorado that every community is unique, and there are numerous ways that this work can be customized in alignment with the legislation to meet the diverse needs of your individual community. It's encouraged that all community members are engaged to adapt the curriculum and to drive planning and implementation to ensure it meets those specific needs. This means an expectation that parents, school staff, and especially young people are all working together to identify what comprehensive sex ed should look like here in Delta County. And based on our research and alignment, our grant program has identified 6 curricula that have been approved for our grantees to use across the state. Grantees are also allowed to create their own curriculum with approval as long as it aligns to the guidelines of the law. So lastly, how can we help? You all are the experts of your community without a doubt. And as a resource for your community, our program has just worked to support technical assistance and trainings to kind of prepare and get schools ready to think about how they want to implement comprehensive sex ed. So we have supported adaptations to several of the approved curricula to expand upon the needs of LGBTQ+ community, youth with disabilities, youth of color, and immigrant youth as required by the law. We also currently fund 9 schools and districts across the state, including several rural communities. And we're available to support our non-funded community partners as well and can provide you all with answers or support in answering sort of what does the legislation mean for CompSex Ed? How do we navigate this? How do we customize implementation in alignment with what needs to happen for our community? So I'll just say that's sort of how we are available and can help and serve as a resource. And that if you have any questions, you're welcome to email Deja or myself at any time, and we can share our email information. And that's all we have.
That was well timed. So we're going to continue with our panelist individual discussions. These will each take about 5 minutes. And so I'd like, if I could, please start with Chris.
So I can actually say that I have experienced severe bullying in schools that are in Denver, as well as the VOTEC here in Delta. I went there for a few months before I couldn't handle it anymore and completely dropped out because of the harassment. And that's very unfortunate, because to get a lot of jobs, especially in this area, a high school diploma is required. And I had to give that up. I have experienced sexual harassment and assault because of my lack of education, because of the lack of a inclusive education. I didn't know who I was for an extremely long time. I am an open trans man, and if I had had that, I wouldn't have experienced half of the confusion, of the self-distrust, the self-hatred. I would have not gone through any of that if I had had that education, if I had had that experience to tell me, hey, what you're feeling is okay. You are not alone. I wouldn't have felt alone for multiple years of my life. I am 19 years old. I am about to be 20. And I was assaulted when I was 5. Because I didn't know what consent was. Because I didn't know any better, and they decided to take advantage of that. And that's the disgusting truth of the world. People aren't educated, and people get taken advantage of. And that is why I fiercely believe that this is necessary. We need to teach children about consent. We need to give them an inclusive education that they are able to go, hey, maybe I'm not alone. Maybe I actually have a reason for feeling this way. And I'm trying to figure out how to word this. I have experienced the good of the world. I have experienced some amazing people. Having you all sitting here right now and listening, I deem you amazing people, because not a lot of people would do that the way I grew up. I've also experienced some very evil people in the world. And I know that if I had had a chance to know better, if I had had some people go, hey, you shouldn't just run into this and trust all these people because you're going to get hurt, I wouldn't have been hurt. I wouldn't have been hurt for nearly 11 years of my life. that's why I'm here, to share my experiences, to go, hey, this isn't okay, but we have a chance to fix this as a community. We can come together as a community and fix something so that people don't have to feel alone. So people don't have to feel like they have nothing and no reason to be here, and that bullying is all they're going to experience in their lives. That's why I'm here. I don't have a bunch of titles. I don't have any experience as a pastor or a group organizer or anything. I'm just here as a voice of reason to say, hey, this happens. We have a chance to fix it. So can we try?
Hello and thank you all. Like I said, I'm Javier Saenz. I was born and raised in Delta, Colorado, and that's my biggest reason for being here. I'm invested in this place. I've raised children here, grandchildren. My family's from here. My mother was the second oldest of 18 children. So, yeah, this town is pretty much full of my family. And a lot of them agree with me and a lot of them don't. A lot of them use religion to justify why they don't want to speak with me. And unfortunately, religion's no reason to not speak with anyone. But I grew up here, and at the age of 18, I finally came out as a lesbian in 1991. And I came out as a lesbian because I did not understand who I was. When I started hanging out with more of the LGBTQ plus community, I started, getting to know more lesbians, and I'm like, I'm still not like these people. So I still put myself in a box because it was the closest box that fit me in it, or the closest box that allowed me to be in it. So from there, I did activism, and I did everything I possibly could to let people in Delta know that we're here. I was born here, and I was born this way. It took me to the age of 43 before I was fortunately talked to by one of Delta's great physicians. She no longer works here anymore, unfortunately, but she was questioning about trans people coming out and if they needed a healthcare provider, which, of course, people who are not trans don't understand how important it is to have healthcare providers who understand who we are or care who we are. So I started questioning myself, is it time? And we shouldn't have to wait. 43 years is a long time to find yourself. And I vowed to be that person for all these kids so that they understand who they are. I'm not out there, recruiting children to come to the dark side or, anything like that. I want them to understand who they are. And I want them to love somebody because they love somebody, not because it's expected or not expected of them. I found a beautiful wife, and she is a straight woman. And if it wasn't for somebody who was open to just love, I don't know if I would have found it. That's not something our children should have to worry about. It's not what... Sorry. It's not what I should have to wonder for my own children, because we do have children who identify as all the letters of the LGBTQIA in our children and our grandchildren. And they are our future. And they don't need to feel the way that we felt. They don't need to hurt themselves. They don't need to question themselves. And they certainly do not have to question if their parents love them. Unfortunately, because they are not educated as cis straight people, they don't feel that they need to understand the LGBTQIA community. That is so wrong. When you don't understand us, you stop loving us. Whether you're our children, our parents, our brothers or sisters, our friends, our pastors. And unfortunately, we've been pushed out of a lot of churches because we are not welcome. And my God's loves me unconditionally. And I may not go to church, but he is very much relevant in my life. And he will always be. So I am here so you all can understand, or that you can share this message with other people. Education is how you love somebody. It's what you do with your children. You teach them because you love them. You don't just let them fall over when they try to walk. You help them, you guide them. When they try to ride a bike, you hold that until they're steady. When they get to school, you teach them what they don't understand. I mean, it is our job as parents to educate. And unfortunately, not all of our parents understand their children. And this is where the education needs to happen in our schools. There are a lot of things that are hush-hush. Sometimes in a Latino family, being gay or trans is something you just don't talk about. They may know you are, but you don't sit about and talk about, pride at the dinner table. We do now, absolutely. But, those marginalized communities that are even more marginalized by being, of color, it's those things that, we don't talk about this stuff. We don't talk about this stuff. When you find out that your child was hurt by their uncle or whoever it is, you don't talk about that stuff because it's embarrassing. We need to stop making it embarrassing. Our children's pain is not embarrassing as adults. How embarrassing is it of you to say, I allowed my child to get hurt because I didn't want anybody to know? That's disgusting. That's child abuse. And it just needs to change. And it is time for a change, Delta.
I just want to start by saying thank you. Thank you for sharing your stories. So grateful for that. Thank you. So as I mentioned, I manage the Youth Sexual Health Program at Trailhead. And Trailhead is a public health institute based in Denver, but we serve the entire state of Colorado. And underneath the Youth Sexual Health Program, we have a few projects and initiatives, but our WISE initiative is the work we do to support school districts and communities implement sex ed in the classroom. So WISE stands for Working to Institutionalize Sex Ed. It's been in Colorado for over 10 years, and during that time, we've served and partnered with over 30 school districts and communities all across the state, so including both rural, urban, and suburban districts. So we currently partner with the Learning Council and to support them with the amazing work that they're doing in sex ed for the community and for the young people here. When we partner with the school district, we support them in a collaborative process to plan how they want to implement sex ed in their schools. So we also acknowledge and recognize that each district and community is unique, which Danielle mentioned earlier. And so with that in mind, we really honor that and center that in all of our interactions, right? So when we work with a metro school, that's going to look a lot different than working with a school in Northeast Colorado, and as it should. So as we go through this process with school districts, we really center and honor this fact throughout the entire planning process. So one way we try to support through this planning process is helping schools understand the state sex ed requirements, including all the amazing information that Danielle and Deja shared. Thank you. I think I learned some new things. But also the state health standards. So the Colorado Department of Education, also known as CDE, revised and updated their health standards. And these standards outline health topics, content, and skills that schools are expected to implement and prioritize all throughout the K through 12 grades. And sex ed is one of the content and skill areas of health that schools are expected to teach. And CDE outlines sex ed content starting in 5th grade with human growth and development. And I believe Jamie Hurley is the contact at CDE, and he left us with a resource, correct? Okay, never mind, sorry. That's to be...
Well, we do have a resource. Our group put together... DC Cares put together a little zine that has some resources on comprehensive sex ed. It's over on the table over there, so you can check that out.
Thank you. Yeah. But also, CDE does have those health content areas that you can just go on their website and learn more about those. So as we partner with districts, one thing that we've noticed through doing this work is that a lot of districts and the community members of those districts are really surprised about what they think sex ed is and what they learn sex ed isn't, right? So there's a lot of beliefs that sex ed is just pregnancy prevention or just STI prevention. Which it's not. It is a part of it, absolutely, and that is a potential outcome of this education, but it's not the full scope of sex ed and what it covers. So for example, sex ed is actually really rooted in social and emotional learning, right? So it includes topics such as healthy relationships, not just the romantic kind. But what do healthy relationships look like in all of young people's interactions? And it also dives deep into topics about consent, right? And how to navigate hard, uncomfortable conversations about consent with their partners and in their relationships. It also allows young people to build skills to utilize in their everyday lives. So the social and emotional learning isn't just specific to sexual health, right? It builds skills that young people get to use throughout their entire lives, not just during adolescence, but for their entire lives. They get to take this information and skills with them. So additionally, we've learned that the best way to ensure that young people get access to this critical information is through an approach that includes all sectors of the community coming together. Also, Danielle had mentioned that. So I'm just, reiterating it. And also through this, we've heard common things. So for example, maybe from the community's perspective, it's the school district needs to teach that, right? They're the educators. And vice versa, from the school district's perspective, it could be that this is sensitive and private information that only needs to be taught in the school. Family, yep, sorry, thank you, I'm just going. And so not to say that these aren't valid, right? But what's really effective is when every part of the community understands they have a role to play in the health and well-being of their young people. So schools may be tasked with the formal sex ed programming in their health classes, but a lot of students go home and they go into their community and they continue these conversations, right? And they continue it with their trusted and askable adults. And this is just another opportunity to continue this education, but even take it a step further by having deeper conversations that are relevant to that individual student's lived experiences and identities. So ultimately, the underlying factor that brings the community together is the desire to center the health needs of the young people. But for us to really understand what those health needs are and what young people are currently experiencing, it's critical that we ask them. And that we listen, right? But I mean really listen. And do it in a way that makes them feel affirmed, safe, and validated in their experiences, whatever those may be. So finally, we know that young people have had to navigate a lot of dynamic challenges, right? Challenges that I didn't have to experience through school. Like, for example, social media, right? There's both positive and negative things to social media, but how are we supporting young people to be able to navigate those pros and cons to social media? And also living through a pandemic. Sorry, just one second. And also living through a pandemic, right? I didn't have to do that in school. And that short amount of time has drastically changed the young people's lives and impacted them, right? And so how are we supporting young people? So we really move this work forward by engaging young people and letting them choose what they need and what they want, and even letting them lead it.
Well, I will try to highlight some areas that haven't been, because a lot of times when it seems like we're using our study-based information, and my background, when I came to this community, I was doing women's health at that time and was practicing OB. I've delivered over 400 plus individuals, both in Weld County as well as here, and combined over a 7-year period. And I've definitely delivered teens. And so that's where I got interested. I guess that was part of my background piece I probably put in earlier, but I was able to access some of the information at the state. And when I came here in 2008, it was one of the highest teen pregnancy. I think we're a 4th in the state for the counties. And it's definitely come down, and a lot of that we don't know exactly why. But as we've talked about, it's not just teen pregnancy, but guess I'm going to get to the other information. But part of it is access to contraceptions is part of the reason and thought, and the accurate education. And so I think really it's not just teen pregnancy, because when we talk about pregnancy, sexually transmitted infections, it affects anyone, whatever relationship you're in. And kind of from tonight, as well as when I spoke in front of the school board, I think one of the things I didn't bring up then is, a lot of people we don't, and also doing this work and going into the schools, having that understanding, you don't know where someone's coming from. You don't know if they've been abused. And I remember early on, before I even went to medical school, I was working as a nursing assistant in a psychiatric ward. in Eugene, Oregon, and they had a training on that. And I think some of the statistics then were 7 in 10 women at the time have been abused at some time. I mean, and it doesn't matter what their sexual orientation is, that's abuse. And to me, I had never heard that before. And I think I was a little bit probably sheltered because I had 3 older brothers and they kept, protection on me. But I kind of want to protect everyone, and I think we should be able to have this type of accurate information out and discussion of how do we help prevent it? And then how do we help respond to those people that we know? Do we say, I'm sorry, this had never happened to you, and you're not alone, and there is help, and this should not happen to anyone else. And those are the 5 things that if have gone through any kind of violence, those are the 5 things that you can tell them, because it's affirming them. And I guess that's one of the things that I've learned. It's not only educating the youth, but it's helping involve those parents, because a lot of what this information is there's the medical side of it. There's hormones. It's how we're born, and we can get in. There's the genetic side. There's estrogen, testosterone. And it happens to anything. You can have different flowers that come out, or different animal. If do husbandry, there's different animals. Genetics. It changes every time that DNA replicates, something else can change, and that person cannot change that. And so we need to understand that to be able to change the way we culturally construct and we look at some of these topics in terms of the LGBTQ plus, I'm still learning too, communities. And so it's not just understanding the medical side of things, but it's also understanding how do we come at this culturally and how we think about it. Does that create some of what we see? And sometimes that can be hard to think about, but it is important to sit and think about it. And one of the other things I learned about when I did a teen pregnancy talk back in 2007 for the hospital that I was in residency for. And even back then, they identified most folks that become pregnant or have high risks, doesn't matter what their orientation is, they've had some type of adverse child event. And that was what I think was alluded to a little bit, in that we need to have protective factors. People need to have trusted adults that they can go to and ask for help when they think things are wrong, and be able to be told, it's not your fault, you're not alone, there's help, this shouldn't happen to anyone, and I'm sorry. I think that's the one other piece that I just wanted to put that was mentioned a little bit, is we have the internet. And I recently found out that majority of people, 60 to 80% of people, or 50 to 80, depends on your age group. If you're younger, maybe 80. If you're older, even over 60, might be 50, get your information from the internet. So it is so important for us, as anyone who wants to make a difference in the medical area, to be involved on the social side of things and make sure there's accurate information out there. And we want to make sure our kids are able to understand, our kids, our parents, our community are able to understand how to find accurate information. And I think the only last thing was that Department of Education, when I looked at all of their standards for if you actually had to put together a program to be most effective, to learn the different skills, is you have to start younger and you build upon those skills, and that's how they're age appropriate. So you bring in the topics in, but you're building upon those topics. It's just like you don't learn algebra without learning addition. It's no different.
I became interested in sex ed in 2015 when I heard on KVNF that Delta County Schools was teaching abstinence-only sex ed. In 2016, I teamed up with Anna Camp and a bunch of community members who were interested in bringing comprehensive sex ed to the youth in this county. And we began to educate ourselves and others on comprehensive sexual health education. Since that time, we have educated 21 people in the Valley to be sexual health educators. And Anna and I, thanks to Trailhead Institute, have also trained to become trainers of teachers. And then I've also taught comprehensive sexual health education to over 100 students in Delta County School District. Some of them are in private schools. In 2019, I joined the Delta Health Advisory Committee, the DHAC, which is part of Delta County Schools, and started working with Heidi and also Sam Cox, who at the time was the Director of Instructional Services for Delta County School District, to implement comprehensive sexual health education. During this time, it became really clear that this was a hot topic in this county. And a lot of the reason why it was a hot topic was because folks were opposed to curriculum that was inclusive of LGBTQ plus people. A recent protest to comprehensive sexual health education was self-defined as an anti-LGBTQ plus transgendered curriculum. For me, the work of bringing comprehensive sexual health education to Delta County schools has gone hand in hand with working to include marginalized students in all of the school's curriculum and policy so that all students feel represented, safe, and honored in their schools. Thank you all.
Well, I think I'm supposed to offer a perspective, a faith perspective on some of what we've heard discussed here this morning. And I want to emphasize that idea of a faith perspective. If we went and grabbed the 2020 Yellow Pages phone book, and anyone under the age of 35 just said, "What's a phone book?" And opened it up to churches, we would find that in Delta County there's 38 different denominations, Christian denominations in this county. Not individual churches, but types of Christian churches. And there are pros and cons to that, but what I think that reveals to us is that there is a great diversity of thought, of practice, of belief, and that oftentimes we agree on many things, and oftentimes we disagree on a lot of things. And so as I speak today, I speak for myself, knowing that there are people within the larger, broader Christian community and larger, broader faith community. Yes. I know there's people in the larger, broader Christian community or faith communities that will disagree with my perspective, and I respect that. I know there's people in the congregations that I serve that will disagree with some of my perspectives, and I respect that as well. But I speak today as a pastor in the United Methodist Church, as a spouse, and as a parent of two children here in the county. And out of my place of faith, I support a comprehensive, medically accurate, developmentally appropriate what is it? Cheese? Is that what it is? Cheese. And here's why. Our United Methodist doctrine, and I know that, again, I'm speaking from my own faith tradition, states that every person has a right to education. And when we speak of that in the United Methodist Church, we recognize that as a three-pronged process of being families, faith communities, and government. And I think that's important to recognize that this is a comprehensive or three-pronged approach that we advocate within our churches. But I think it's really important that we advocate that for every person, that every person has a right to an education. When I hear that, every person, or when I go to the Delta County School District website and I read their motto, which says caring, challenging, learning, every student, every day, I think, I hear that as an argument for comprehensive education for each and every student that walks into the buildings that lives here in the county. And this is important to me as a person and as a person of faith, as a pastor, because I believe that all people, every last one of us, are beloved children of God. As we say in the United Methodist Church, all persons are individuals of sacred worth, created in the image of God, and that is so important to me. I was talking with some folks just right before here and before our meeting, and I was asked, well, why are you a pastor? and I paused for a moment and I said, the reason I'm a pastor is because I was raised in the church, United Methodist Church, and growing up, I was a nerd, a dork, a loser, whatever derogatory term. I didn't fit in with the in crowd, but I knew that whenever I went to church, that I would be loved and accepted the second I walked through the church doors, and I wanted to offer that to other people. In the world, because I think all of us needs that place where we know that we are unconditionally loved and accepted. And so when I hear some of the stories that we've heard today, they're painful for those who experienced it, but for me to hear as well, because I recognize that my reason for wanting to be a pastor isn't always lived out. I don't always live it out perfectly as well. And so I think for me, I'll just speak from when I send my kids to school, I want them to get the best education that they can get. And I want that to be them to be challenged, to be exposed to the broadest information that they can be. Recognizing that my spouse and I, when our kids come home, we have the opportunity to discuss. And when we go to church, we have the opportunity to teach and share. But when I send my kids to a school, a public school, I want them to get that comprehensive education. I think that's why we have public school systems, and I think that's so crucial. If I were to make a religious or biblical argument, this is where you handed a mic to a pastor. So I'm going to start quoting scripture. Is that time?
It's almost like a sermon.
Yeah. All right. So I'm out of time. Let me say this. 13 times in the New Testament, we're commanded to love one another. And I was really struck by the words that Javi said. When you don't understand, you stop loving us. And education is how you love somebody. If Christians are called to be people who love one another, then we should be doing everything we can to love each and every person in our community.
Thank you, Josh. So here is where the rubber meets the road, because we'd like, if you would please be willing to join us into small groups. Okay, could we pull all the groups together, please?
My name is Mindy, and I guess the burning question, what I learned was that, I told my group that I identify in as a Christian and I go to church, and it sounds like our community is not doing a good enough job representing the doctrines and principles of our faith and reaching out and making people feel welcome and able to talk to us and come to our church and then the burning question would be, what can we do to bridge that gap between what people think this curriculum is about and what it's actually about and how it can help children.
Thank you. How about group 2?
One of the big things that they learned that was kind of disturbing to them is finding out how high we are on the teen pregnancy. That definitely was something that is, for any parent or grandparent, it is disturbing. It's a scary number. And as far as burning questions, I think I would like to take this one. Knowing that we have such obvious inequities, pregnancy and other types of situations, insensitivity to gender and people of color, at what point are they going to be under legal scrutiny to provide this type of education for the people who need it?
Good question. Thank you, sir. Oh, you can keep that, yeah. Group 3, please.
Our group talked about, in terms of learning, we saw, obviously we learned beautifully from the people who gave us their personal experience and underscoring that these are God-given rights that we come into as human beings, but it's the adults and the teachers in the community whose job it is to uphold, protect, and defend and make those rights accessible in our lives. And so we also focused on that education is a way of loving. And so looking at that, some of our burning questions were like, how do we be culturally sensitive in this particular community, Delta County, which seems to have a very strong traditional orientation to all things education, family. Sometimes it's also related to church, but that is also seems like there's some kind of fears and discomfort in there too. One thing we also learned is that even though this was billed as a community conversation, some people maybe didn't feel completely safe to engage in the conversation part, and so they didn't count down and make that number, be part of the numbers game to be vulnerable enough, or maybe they didn't feel safe enough to actually enter into the conversation. But I think what we really realized more than anything is that everybody in their families or in their extended families or their friend circles has somebody who represents a diversity of representation, a diversity of sexual expression, a diversity of historical, what happened to them as a kid. Were they among any of the people who are in the statistics for abuse? Do they know anyone in their family who was a teen pregnancy, or who is having a different gender expression than the cisgendered norm of Delta County? And when we can get at a personal level like that and see, nearly everybody we know knows somebody or is connected with somebody who's a little bit outside of the box, that maybe that's our best entryway into getting the basic tenets of the human rights and consent and knowing our own body and being able to have more healthy lives. So, yeah.
Thanks, Meg. Am I on 4 now? I can't count very well. So group 4.
Yeah, in group 4, I think we talked a little bit about learning about some of the statistics in Delta County as they relate to other parts of the state, and having that, especially opening our eyes, because that was reported by the students themselves, and so that was eye-opening for many of us. I think the other thing that we really learned were from the personal stories that we heard of the difficulties that some people face in just expressing themselves and who they are. Our burning question was similar to some of what we already heard. Is how do local cultures, the Delta County culture, get incorporated into it's not a curriculum, it's a program, into a sex ed program, and how do we allow that to be expressed in a unique way that's appropriate to our county?
And last but not least is our most engaged group, Group 5. So it was hard to stop you guys, but you were really with it. So here you go.
Actually, it was enjoyable, and I was able to hear people that I wouldn't otherwise have access to hearing. Say the first question for me.
What did we learn?
We really only got one person to give a clear answer to that, and it was that there are so many different reasons, a whole wide breadth of reasons for exploring bringing this kind of curriculum to our school district. And our conversation was animated and informative, but we really never addressed, again, either of the questions. But it was... Huh? No, I think there was so much to discuss in such a short time. And I think what I learned, and I hope that's fair to say, is how much discussion still needs to be had, that there are a lot of people, in my opinion, on both sides, who don't feel heard yet in this discussion, and that I hope I don't misrepresent anyone. I really tried hard to hear that. I think there is some concern, and this was news to me. I learned this. This was information I gained in our breakout group, that people feel perhaps that not that their own personal faith, but that the structure within which they practice their faith will be undermined if a curriculum like this comes to the county. And we didn't have enough time for me to really hear how do you envision that happening. But that was interesting to hear that was a deeply felt concern, and it showed me that a discussion where people from both sides of the table are in small groups. A big group, you can't hear everyone. That when we're from both sides of the table, and there's actually, I think, more than two sides to this. If we really sit down, we had people saying, "Well, change my mind. I'm open to this," and people saying, I'm less open to it, and people saying, I'm all for it. And I think there are even more sides than 3 sides. But if we have people from divergent opinions sitting in small groups, really letting one person say, I can't accept this because, or it must happen because, and really trying to do our best. Not to say you're going to take something away from me, you're going to undermine my faith, but to really hear each other. And I'm not just speaking of the people who spoke directly of faith. I could feel afraid that you're taking something from me, so that what the burning question we never really got to, but the burning issue that was living in our group was people still do not feel that their voices are heard. That's all I can say.
Well put for a very complicated conversation, so thanks for that.
I hope that you guys were okay with that.
I was disappointed that some people chose to leave, but that is, we encourage people to pass. If they don't want to participate, that's fine with us. I do hope that there were pieces that people pick up. That's really great, but I did acknowledge that there was a person in our group that didn't necessarily agree with the panel, and I thought it was very courageous of that person to stay with it and be part of the group and be part of the conversation. So those of you that did that, when you heard the panel, you may not agree with what you heard, but you stayed with it and you went in the group. So let's have a round of applause for those. And then next, I'd like to invite any of the panel members that want to address some of the burning questions that came up in this, and then we will close with just general questions and answers, okay? So we'll give ourselves maybe 10 minutes for that, and whoever wants to start.
I just wanted to answer because I got... In the medical world, anything past 7 years is outdated. So you are right. Talking about 20 years ago is outdated. So 1 in 4 women or 1 in 3 women and 1 in 4 men have experienced some type of physical violence by an intimate partner in their lifetime.
Can you define what physical violence?
Yeah.
That means. Are you
and
saying?
In lifetime, is that just considering children, or is that because it sounds like from lifetime?
Entire life. So the way statistics work, so you have to define it. So a rate is going to be the occurrence per time period. And you can define that time period as a day, a month, a year, or a lifetime. And it's averaged, and it's really hard, I agree, because I talk to people every day about statistics. And it's sometimes challenging our brains. If you ever want to read a great book, I have still had a hard time getting through it. It's called Thinking Fast, Slow. And it's the meta-analysis on how our brain works and how we interpret the world. And it's different. We have different pieces of our brain to be able to interpret it. And so the piece I guess I wanted to put in terms of the rates is that it's hard to understand a group statistic because if it happens to you, it's 100%. And the way we look at statistics is based on how we view risk. And we all view risk very differently. Do you invest in the stock market? Do you only put stuff in the bank? Do you actually buy a home or do you rent? Those are all pieces that decide how we take risks. I'm not saying that that's going to determine all your risks, but the way we view risk will be how we look at statistics. Does that answer? No.
Yeah, if we could hold questions till the end, I want to give the panel a chance to hit any of the burning questions they heard from the group. So if you could hold that, please, we'll come back, okay? So if a panel member wants to answer any of the burning questions, one of them was culture, and about how do we incorporate the culture. The other one was honoring the religion, the religious beliefs, those types of things.
Hello again. So the burning question that I actually want to address was from my group. And that is, how do we bridge what people think the curriculum is versus what it actually is? And there was a lot of discussion about this in my group, actually, that tied back together. And one of the ways that we could lead into not pushing so much as explaining this topic is starting talking to children very young. And I'm not talking, tell them, it's okay to go do this. I am talking specifically about consent. And when I say consent, I mean making sure that they know from a very young age that they have a safe place to go, that they have a safe person to talk to that is not going to harm them, judge them, or otherwise make them feel unheard. And I believe firmly that is how we can explain how this curriculum actually works versus what people are making it out to be. The curriculum is explaining consent from a very young age, and then when they get older, adding in more age-appropriate discussions. And we normally have our sex ed talk at around 5th grade. For me, it was 4th. But we don't bring up conversation about intercourse until the proper age. But before then, we need to make them understand that this is okay for this age and monitor what's going on at home, how they react to this, if they feel safe at home or in school, or we just need to make sure that they feel safe, because if they don't feel safe, there is no way we're going to be able to introduce this as a community. Does that make any sense?
Excellent. So, sir, you were anxious to ask a question.
These are questions. Who knows what stranger danger is? Says, when you have stranger danger, where do you go? Now, you all are talking about consent. So, and there is that's in a broad view the same thing. Stranger danger. These children already know that. He says they don't need to be brought into the other vast mirage of sexualities.
So part of your concern is really what people are being brought later. What question do you have?
Why are we pursuing it in the first place?
Okay, great. So I'll take it to... Yeah.
That's just a question. Let me ask the second question.
Okay.
You're talking about statistics, and you're talking about one in 4 people have been abused, experienced. Oh. Okay. Now it says you didn't say sexual. No, you said physical violence.
That's what this is, physical violence.
Okay. Now physical violence.
By an intimate
Is by an intimate person. Who's ever been spanked by their parent? Who's ever been pushed off the teeter-totter by your brother or sister? Who's ever been in a high school? Well, it says.
But that's included.
Who's ever been raped or
That's
molested
right.
by a
So
family
how
friend?
can everybody? Everybody has experienced those
So,
things. So it says your statistics are fundamentally wrong because you're cherry picking.
So there's a real question about the statistics that are coming in, and also there's a question about what's the severity of it. So, and I think,
why are you using it in the first place?
Yeah, exactly. Thank you. Please. Sure.
So my thought about, stranger danger is along the same lines, but if you just call it stranger danger, it doesn't identify that most of these folks are going to be abused by their family members or people they know. I mean, that's even the whole statistics of being kidnapped. It's usually people that are known to that child. And then the second thing, in terms of defining it, I think it goes back to the cultural constructs, and we really do need to look at, should we be slapping or spanking our children? And that's again, that's a bigger social emotional learning piece that needs to be discussed. So I think they're great questions because it's highlighting.
Thank you for identifying my concern.
and talk around it. Says you haven't addressed the situation though. You're just saying, yes, I feel for you. That is a very skilled technique of intervention and the escalating.
We can talk some more afterwards if you'd like. I'd like this
to continue.
participant to be able to ask her question.
Sure.
So.
Okay, here you go.
I was wondering, how early is consent going to be taught and in what capacity? Because before a kid's even old enough to consent, why would they be taught that they can consent? Why, what it seems like if you teach a kid that they can, if they have a choice, maybe a rebellious kid but it just seems like, it's easier for somebody to talk a kid into doing something. Why wouldn't it just be like nobody's supposed to touch you at all? Like, oh, you can say yes if you're into it. Like, it seems like that's superseding the parents in a way. Like, if they've told them, no, you're not allowed to have sex at like 5th grade or wherever you're introducing these topics at, and you're telling something completely different that's being taught in the home and saying that the parents are wrong and they wouldn't have this information otherwise. That would be my main concern, is how do you address consent?
Thank you.
Yeah, I think to your point with consent, like, we're not disagreeing with you as far as like communicating like what you are to the child, as far as like you shouldn't have sex before 5th grade. What we're really talking about when we're referring to consent is this is what you agree to or what you want to happen or what you like and not what you don't. And I think that's so important for a kid to be able to articulate to someone else, especially another kid, right? Is like,
kids have no problem, sorry to interrupt, but kids have no problem articulating what they want. And they want stuff, and when you tell kids that you can make decisions that are above your pay grade, that's maybe something that parents don't want to be contradicted on by an institution that, what Chris was saying is we encourage, if somebody's beating you or come tell us, we're your trusted person. The school isn't the trusted person. And it upsets me that the school is giving the kids permission and saying, come to me when you have a problem.
Well, and I think it's just important, though, that like if there is instances of abuse where a parent is abusing their child, that the child is able to speak up. They're not going to speak up to their parent because they're being abused by them. They have to have another trusted adult to be able to talk about their abuse. And maybe what you deem abuse is different than how the child deems abuse and how they feel it is. And I think that's important that we really understand that schools should be able to intervene, if possible, to really have a trusting relationship between the parent and the child if abuse is happening.
Intervene or have a conversation with the parents.
It
seems
is.
like a superseding and a usurpation of all the parents' teachings and.
But the teachers know better than the parents do, or the community.
And okay. And I was gonna just say, like, when we're engaging with schools, that's not how it's supposed to be. It's a conversation with parents and teachers and the youth all together.
But
really.
as an adult, hearing you guys talk, that's what I was hearing.
So there's a big concern by people about the influence of the school versus the influence of the parents. That's what I'm hearing. I see a lot of shaking heads and, okay, just time out. Yeah, it's not an absolute, but there is a concern about that. And, what we're trying to do here is not have a debate about the right or wrong of the issue. We're trying to really understand perspectives. And I really appreciate the perspectives you brought up. It's good that you've done that. I think it's important, though, that we continue with questions, because at this point, we're trying to do the questions and answers, genuine questions that people have, rather than using this as a platform. So,
well, aren't you having a platform here? Trying to educate us on what the good things are that you have to sell? But we, as somebody who opposes or has a different thought, then it becomes a debate.
And we appreciate you coming out to listen.
No, wait a second. Please,
you're also consuming. You're speaking more than the majority of people in the group, and you should give some platform to others people to speak.
I'm
please.
answering the questions. I didn't.
They didn't ask you a question.
Oh, no, I did.
I spoke with Amanda Campbell today by private message. We indulged in a conversation. conversation. And my question to her was, Pastor, God does not ever change. What that Bible says is what God to this day still means, no matter how bad we try to interpret it. I don't hate any of you people. I don't hate any straight people. I don't hate because the Bible tells me not to. But what the Bible does teach me, and there's many, many things, I worry more about y'all's souls than any of this crap.
Is this a question?
It's not.
It's preaching. That's great. There's room for that. But I have a question
It is a
that
question.
also speaks to the previous question.
It is a question.
And I think other people would value the
My
response.
question is,
If you'd like,
this is
okay,
what-
then get in line, please.
See, this is what you guys do. Is you guys?
No, I'm not with them. I'm just me. I'm just me.
But you are interrupting. You interrupted.
Excuse me, she interrupted me. All
You
right.
interrupted me first.
Because you are just grandstanding and being the big white man that has to gobble up everything.
Let me.
And there's my proof.
If I could
My
reiterate,
question is,
we're asking. Let me finish this, please. At the beginning, we asked for respectful questioning and communication. We encouraged positive assumptions. We ask, how can I be constructive of this dialogue? Some people may not feel that they've been heard, and that's probably why there's so much emotion that's going on right now. And animosity, yeah. Agree to disagree without being disagreeable, and exercise self-restraint, see if we can find common ground. I think a lot of people would agree we want safety for the kids, right? Can we just agree on that we want a safe environment for the kids? Okay, so those are the things we're after here. What parts can we agree? Again, I want to reiterate that this is not the debating society, and we're not here to try and push, a particular viewpoint. We're providing information, and you'll disagree with that because you see this panel is being slanted. The Learning Council is trying to present information from the perspective of people that are trying to bring that in. They feel strong about it. So.
okay, I do have a question for you folks. This agenda that you guys are trying to push onto the Delta County school system, we have already voted no. And this is what I told Amanda Campbell today, is we voted no on this, wide and clear. But then you guys bring in your panel to educate us, because basically we don't know how to teach our children. It's wrong of you guys to try to push this onto our children. Another thing that I asked Amanda, I said, Amanda, okay, say this gets passed in our school system. Are you guys willing for us to pass an education for our children from a biblical standard, give each one of our children a Bible to read, and mark in that Bible of what sin and what sin is not? Is this panel apt to that? No, you're not. Why? I would like to know why. Why can't we teach our children the aspects of what? Go ahead. I would like to challenge you on this.
As I said at the beginning, how many churches are there in Delta County? Right.
And it doesn't matter about if you're Methodist, Lutheran, Jehovah's Witness. It's the principle of what that Bible tells us.
Right. But
for you, that's a really important thing. And and so
Right.
you don't feel that it's an even playing field.
Because
Yeah.
if this can be presented in our school, then I believe that Jesus Christ, our Lord and Savior, the book, the manual of our lives, and quote me if I am wrong here, sir. You are a pastor. Leviticus, it tells you all about a man and a woman sleeping together. It talks about no man should lie with an animal. No man should lie with a man. No woman should lie with a woman. There is a reason for that. And so to me, if you guys are willing to educate our children in this way, then we should be able to bring this into our school system and educate our schools with a biblical principle of how it should be.
Thank you.
They're not going to listen to me. I'm out of here.
From somebody who went to Delta County schools, I pretty much had a biblical education here. I also got thrown out of numerous churches for who I am. So that is not a God-loving church, to throw me out of a church because they don't agree with who I am. So, no, what I'm saying is, hold on, I'm answering you, please. Have a little bit of respect. What I'm saying is, you want to put a biblical standpoint in church or into schools, which there is a separation between religion and political, and church is very much political these days, and so is school. Now, I've noticed in Delta County schools, we've been given Bibles. I was given a Bible. They were given Bibles in the middle school. They were left there for anybody who wanted one. There were also things about people who didn't believe in church itself. They were given it. No, I believe as a parent, if I didn't want my child to learn about shop class, I'm not going to let them go to shop class.
Thank you.
So,
Amen. I don't want my
but that
children
doesn't mean that shop shouldn't be taught in general. No, we're talking about education. As far as sex, and you're talking about no spots and stranger danger, I will let you know. This is personal, but I'm going to let you know just to give you a little bit of insight. I was sexually abused by 3 members of my family. There was no stranger danger. But what there was, no education. I was told to shut my mouth and not talk about it. Why? Because it was embarrassing, which is exactly what you're telling me. So my school would have told me, it's okay to talk about this. It's okay to say that he did this to you. It's okay that that man should go to jail for it. That's where this will tell somebody it's okay to talk about what happened to you. It will also teach men who are the primary abusers what not to touch and who not to touch. So that should be education that most men should learn. And unfortunately, people have not taught their children not to touch other children. So until you can teach your children to stop doing that, maybe the education system wouldn't try to do it for you.
Thank you. So I'm feeling real awkward right now because I was asked to moderate what I thought was a learning event. And what it's turning into for me is a public debate similar to what happened at the school board. And I'm concerned about that. I'm concerned that I don't see the responses, that I'm welcoming people to come up and ask questions, but I'm not getting questions. What I'm getting is a soapbox. So I'm willing to bring people up that have questions, and I know you've been really patient, so if you want to come up.
I learned very quickly in the first grade that if I wore a dress on Friday, flip-up day, the entire playground was going to see my panties. So I learned to stop wearing dresses on Fridays. And I don't think my parents realized that was going to happen. My parents were great. I didn't necessarily go home and talk to them about it. Maybe I did. But it would have been really nice that the playground staff, that other witnesses, other kids, older kids would have helped teach me ways to consent and say, that's not cool. And also teach the other kids, like, hey kids, like Friday flip-up day is overrated. So can you elaborate a little bit more at the early age of kindergarten and first grade, what this we don't want to just hear like communication and consent, like what's that key phrase? Like let's break it down a little more in a context like that.
I can start, and then maybe Adrian or Deja can fill in. So consent is something that someone was talking that we oftentimes will scaffold our education, right? So you learn addition, you learn subtraction, you learn fractions, you learn algebra, you learn calculus. And so any kind of education is shown to be kind of effective through that model, right, of scaffolding. And so consent in sex education is really similar. So when we're talking about consent in early ages, it's really just identifying, like, what is a boundary? Do you have a personal boundary? What do you like? What do you don't like from people? Giving an individual or a young person the opportunity to sort of start identifying what it is and who they are and what they do and don't like. And it's as simple as like, I like blue or I like green or something like that. And then as they get older, the conversation will shift based on those experiences that young people are having, so that eventually in older ages, it may start to shift to a conversation around how is consent. How does that work with relationships? How does that work with sex? How does that work with other experiences our young people have? So it's really, really different across the age groups. Anything to add? But anything, I just want to make sure that they can add before.
I would just add that body autonomy, right? So like Danielle was saying, like those early ages, we're talking about friendships, right? Not necessarily romantic relationships, even in the earlier grades. And so like giving young people the opportunity to say, no, I don't want to be hugged. I don't like to give hugs. Like giving them the autonomy over their body to make those decisions about their personal space.
And I think that's so important too, like just with even kissing or touch, like I don't want to be touched, or, you know, going back to what you said, I don't want to be hugged. I think that's so important that youth have the opportunity to articulate that to one of their peers or to even just another person in general. Because if they're not given that opportunity to talk about it, then how do you expect them to be able to communicate later on what they like and what they don't like? They're not going to be able to because they don't have the skills to be able to have those conversations.
Thank you. And there's a very patient person in the back here who also wants to ask a question. Thank you.
So this is directed for Colorado Department of Public Health and Education. I don't necessarily agree with this, but I'm here to listen and kind of get the other sides, right? And when this all came up, I did a lot of research, and I found a group by the name of an acronym of SIECUS, S-I-E-C-U-S, Sex Ed for Social Change. And from my understanding, that's where a lot of these guidelines that once the curriculum is adopted are based off of. And I guess for me, I'm just trying to figure out where the guidelines came from, exactly what they are, because we hear that it doesn't start in, the sex ed part starts in 5th grade, but K through 5th grade is about consent and communication and stuff like that. But as a mother to a 13-year-old and then also a 4-year-old, I can see the change in, as the older one has grown up, and where I can see a purpose behind some of this. But then for like my 4-year-old, she's not gonna understand a lot of this stuff. And there's also, we have to remember the disparity between like the Front Range communities and Delta County, where we're one of the poorest counties in the entire state, which I think has to do with, there's a correlation there to like our high pregnancy rates and probably drug use with the parents and not being absent from their lives. So I'm just trying to figure out, where the guidelines were developed. Like, was it a national group? And I understand it's Colorado too, but is it a national group? And exactly like where we can read the curriculum and see what, kindergarten, 1st through 2nd, the age range and what exactly it's taught and why it's taught.
A person who truly wants to learn. Thank you.
Oh, so
So I can start with that. So there are several different curricula for sex education. There is not just one. In Colorado, for our grant program specifically, we identified 6 that we pre-approved for communities with the expectation that they would adapt it for their needs after talking to parents and young people, and specifically making sure that it fits sort of the experiences of the young people in that particular community. And so even beyond that, a lot of our grantees have decided that they didn't want to use one of those 6 curricula, so they're creating their own, and they're going through an approval process with us in partnership. But a lot of the curriculum are created in different spaces. There's different guidelines, different curriculum used. The sex education requirements that are put in the legislation are actually really complementary to the existing state comprehensive health standards. So that's sort of the basis that we start on, which already includes a lot of that information, and then building it out further to ensure alignment with the new legislation.
I think we arranged for this to go till 6:30. Is that correct? Or 7, yeah. What I'd encourage is people that have seen this as a model, if you disagree, I encourage you to have your own model and do your own panel discussion and bring your own viewpoints in if you feel like it's not well represented here. But we'd like to close with the last few questions. I would like to thank our panel members for their participation here, and thank our people that facilitated, and also thank members of the public that did come and sat through this. I appreciate it very much. Thank you much. You're encouraged to continue the conversations in smaller groups, one-on-one, or with one of the panelists. You're more than welcome to do that. Thank you.
Is there an easy website to find these curriculums and look at them? That came up in our group.
So you can reach out to us for the list of curriculums. We're happy to share. I will say that all of the curricula are owned through different companies, so you have to go through those individual companies typically to get access. We do have copies, and I know Alicia also has copies that she's happy to share for folks to review as well.
Thank you.
But the Colorado Department of Education does have the academic standards for health, and that's a really easy place to go.
Exactly. Yeah. Those are the standards,
and go through the different grades and see what the academic standards are.
Exactly. So if you go Colorado Department of Education, comprehensive health standards, it'll pull it up.
Okay.
And it gives all the evidence there and how it's changed and that kind of information. So it's basically any curriculum is going to be written. You're exactly right, and it's going to be written by different people, and that's
But if you're trying to sell me a Ford,
no.
Well,
you know,
can we get it emailed to us right now? Like, can we give you our emails and we get it right now?
Yeah.
That sounds like a great idea.
each of the 6 curriculums,
Some of them
or the
have
specific.
a cost.
Oh.
So
Some are free, but some have a cost.
Why?
Can I?
Can Alicia get it? Alicia can.
I have all 6 of the curriculum.
Can you email them to us?
It's not an email, but many of them are books. And so if you'd like
We are taxpayers. Why
Is there a time that we?
cost to this?
Where would we be
Books
able to?
cost money, curriculum costs money. You can ask the school.
I
Their
understand
curriculum
that,
costs money.
but to make it
And we
easier
pay
on.
for that.
The electronics are getting dicey, and we're getting lightning in here, so I encourage people to go to shelter. Thank you.